Okay, so this is going to be the medical station for the practical exam. In front of us, we have the candidate Devin Roth, the executive director of UMass EMS, and I will be proctoring the exam. At this time, are you ready to begin?
I am.
All right, so time starts now. The scenario is you're working at stationary treatment in Lot 11 for the commencement barbecue when a middle-aged female approaches you with her 8-year-old daughter who just vomited all over their family's picnic and feels itchy all over. You may now begin.
Okay, is my scene safe?
Yep, your scene is safe.
Okay, I would take BSI and PPE for both me and my partner.
Okay, and what would that include?
Gloves, a mask, and eye protection.
Okay, you may continue.
Okay, so I only have one patient, is that correct?
Yep, you only have one patient at this time.
Okay, and are they alert and talking to me? Like, what do they look like?
So the patient appears ill in appearance, but they are alert and they can make eye contact with you.
Okay, it sounds like there was no C-spine trauma indicated, so I would not take C-spine precautions. And because I only have one patient, I am not going to call for additional resources at this time. So the next thing, again, I would assess alertness. Are they still alert?
The patient is alert.
And when I talk to them, do they speak back to me?
Yep, so your patient can answer your questions.
Okay. So I know that my patient has an open and patent airway because they're speaking. And then what is their breathing? I'm looking for rate, rhythm, and quality.
So the breathing is fast at 32 respirations per minute, and there's symmetric chest rise and fall.
Okay. I would at this point check for lung sounds. No. I'll check for lung sounds now.
Okay, so you notice there's some wheezing in the lower lobes of the lungs bilaterally.
Okay. Because of the fast respiratory rate and the wheezing, I'm going to place my patient on a non-rebreather at 15 liters per minute. And because I'm giving a medication, I'm going to check the 5 rights: right patient, right dose, right medication, right route, and right documentation. So next, I'm going to check their circulation. Is there any major life threats to the patient?
No, quick exam finds no major external hemorrhage and no physical injury.
Okay, I'm going to check a pulse and check cap refill.
So pulse is present at the radial at 82 beats per minute. Radial pulses are equal bilaterally. Cap refill is 2 seconds.
Okay. At this time, I am going to request ALS because I have a 8-year-old pediatric patient that is in some form of respiratory distress, and I've administered a medication to counteract that. So while I'm waiting for ALS, I'm going to begin my transport or begin to load my patient into the ambulance, and I'm going to obtain a history of the patient. So what I'm going to look for is OPQRST. So when did these symptoms begin?
So these symptoms onset about 10 minutes ago when the patient threw up with a rapid onset.
Okay. And then is there anything that makes the symptoms better or worse?
The patient's unsure, but itching her skin makes it worse.
Okay. And then how would the patient describe the pain?
The patient states, quote, her tummy really hurts and her throat is tight.
Does the pain move anywhere
Nope.
in the body?
The patient is unable to tell you if the pain radiates.
Okay. And how would the patient rate the pain on a scale of 1 to 10, 10 being her arm got cut off?
The patient rates their pain at 7 out of 10 at this time.
Okay. And about how long has the pain been going on?
About 20 minutes, with symptoms getting a rapid onset about 10 minutes ago.
Okay. I'm going to continue the rest of my history with sample. What symptoms does the patient report versus what signs do I notice?
Okay, so the patient threw up about 10 minutes ago. They have tummy pain and they're itching. You notice a rash on the skin and the patient seems pink, warm, and dry and a little diaphoretic.
Okay. I then would ask what allergies the patient has.
The patient has a known severe peanut allergy.
Okay. Does the patient take any medications?
The patient is prescribed albuterol only for exercise.
Okay. Has the patient ever been hospitalized before or have any other relevant medical history?
Patient's never been hospitalized. However, they do have exercise-induced asthma, and they have that albuterol prescription for that.
Okay. And when was the last time they ate?
They ate at the barbecue roughly 20 minutes ago, and the last thing they ate was a cookie that may or may not have had Reese's peanut butter cups in them.
Okay. And what were the events leading up?
She was eating with her family at the barbecue when she began to projectile vomit everywhere.
Okay. That would conclude my history. I'm now going to take a secondary assessment. So I want to check her cardiovascular system.
So nothing's noted in the cardiovascular system.
Okay. How about neurological or psychological?
Nothing's noted.
Reproductive, GI, pulmonary.
Reproductive, nothing's noted. GI, nothing noted. Respiratory, there's wheezing in the lower fields bilaterally, as you previously discovered.
Okay. And integumentary, the skin.
Yep. Integumentary system has generalized urticaria throughout the abdomen and lower extremities.
Okay. I would then take a full set of vitals, so blood pressure, a pulse, a respiratory rate, an SpO2, and a blood glucose.
Okay. So at this time, the patient's blood pressure is going to be 106/66. Their pulse is still 82 beats per minute. Respiratory rate was 32 respirations per minute, but now has been corrected to about 26 respirations per minute with the non-rebreather at 15 liters. SpO2 previously was 92%. However, it is now 100% with the non-rebreather. And the blood glucose is 102 milligrams per deciliter.
Okay. And then I would ask if the patient or the mother knows the last known weight of the patient.
So the patient had a physical 2 days ago, and the weight was 50 pounds, or the doctor also said 22.6 kilograms.
Okay. So at this point, I believe that the patient is having a severe anaphylactic event, and that I should administer epinephrine. Because the patient is pediatric, I'm going to administer 0.15 milligrams of epi, IM, and I'm going to, of course, check the 5 rights: right patient, right dose, right medication, right route, and right documentation. And then I would take another set of vital signs, reassess every 5 minutes, and then continue to the closest, most appropriate facility, not delaying transport for the ALS intercept.
Okay. What site would you administer the IM injection?
I would administer it to the lateral aspect of the deltoid. But if on this patient, for some reason, that site didn't have enough fat or adipose tissue, I would administer it in the thigh.
Okay, and where would you administer an auto-injector?
Into the thigh.
Okay. When should you begin to consider additional doses of epinephrine for this patient?
After 5 minutes, but I would have to contact medical control to do that.
Okay, perfect. All right. You're now transporting the patient, reassessing. Is there anything else you would like to add at this time?
No.
Okay. This now concludes the station. You have a few minutes to think. If there's anything you'd like to change, omit, or add at this time? So.
No. I believe I treated this patient to the best of my abilities.
Okay, perfect. This now concludes the station of the medical practical exam. Good job, Devin.